VA.
Ocala.
God bless America, land that I love. Stand beside her and guide her through the night with the light from above.
All right, 5 minutes after 9 o'clock, beautiful looking Thursday morning. We have a special 1 hour version of Veterans News today. Hank Whittier is not in the studio. Gary Knapp sitting in the captain's seat. Good morning, Gary.
Good morning, Larry. Good morning, veterans, and good morning, listeners out there. We got a great show for you this morning. We've got Dr. Mark Knapp with us of the Ocala VA, and he's got several of his professionals with him, and we're going to have a great show. We're going to talk a little bit about administration over there today, but that'll be just in a little while. We do have some casualties to report, Larry, and we want to go ahead and get started with that. From the Firefighter Administration, we have 2 notices. We have firefighter Prentice J. Tyndall, whose date of death was May 8th of 2016, and he was with the Hugo Fire and Rescue in Grafton, North Carolina. And I want to point out that that firefighter was a volunteer. And we have firefighter EMT Douglas A. Clement. His date of death was the 14th of June, and he was with the New Hampton Fire Department in New Hampton, New Hampshire. And also we have 2 police officers down in the line of duty. We have police officer Michael Catterman, who was with the San Jose Police Department. His end of watch was June 14th of 2016. And we also have police officer Andy Epcapati. He was with the Pearland Police Department in Pearland, Texas, and his end of watch was June 12th of 2016. And we want you to know that our thoughts and our prayers go out to the families of these public servants. And we also want you to know today, from all of our hearts at Vets Helping Vets, we wish our thoughts, our prayers, and our love to the city of Orlando. Larry?
Amazing grace, how sweet the sound that saved a wretch like me. I once was lost, but now I'm found. Was blind, but now I see.
Dr. Knapp, you want to tell the people about one of our favorite places that sponsor us?
I certainly will. It's one of my favorite places to go on Saturday morning. Bob Wine's Camellia Garden and Nursery. Veterans News is brought to us by that organization. They're on 2610 Southeast 38th Street in Ocala. When it comes to landscaping, Bob Wines has what you need. Everything from small plants to large trees, mulch, fertilizer, so much more. And the prices, now this is summer, are just fantastic over there. Bob Wines will deliver. They'll guarantee their plants and trees. And if you drive over there and talk to Lori and her husband, tell them you're a veteran, you'll get a discount. And even if you don't buy anything, go over and talk to them about your plants and trees, and they'll give you plenty of advice about how to take care of them. They're just terrific. Bob Wines Camellia Gardens and Nursery has been keeping you blooming since 1952.
And we want to thank the folks at WOCA, because without them, we wouldn't be here. All right, Dr. Knapp.
Well, thank you very much. We're here today. We miss Hank. As you know, Gary, there was a flag raising yesterday over at Ocala West, our audiology and optometry clinic, and they're still talking about Hank Whittier's knockdown in the veterans boxing match, where he knocked down his opponent. And we had two county commissioners over there yesterday, Commissioner McLean and Commissioner Moore, who also fought in the veterans boxing match. And they were looking for Hank to get into it. So Hank was lucky he wasn't over there yesterday. Okay, well, today we have an administrative show. We're going to talk about how to enroll, some of the new programs. We're also going to talk about some of the veterans programs such as diabetes and telehealth. I was really happy when I came in this morning. We want to provide access and service, and Don here was telling us he got an eye exam and new glasses in 3 days. How about that for service? Try getting eyeglasses in 3 days in the community.
And another a little bit of information is they have a walk-in clinic on scheduled on Wednesday that they can go in, but you got to get there between 1 and 3 and sign in. Otherwise, you might have some problems there. So, for those who live in the area and take advantage of this, because this is a real organized group there that's real hand.
Yeah, Don's referring. It's a wonderful program, and I mentioned at the flag raising yesterday, 50% of veterans and non-veterans in this community, when they get $6,000 hearing aids, put them in a drawer and don't wear them.
Wow.
And insurance doesn't pay for that. And the reason people don't wear their hearing aids is because they need to get them adjusted, or they need a little bit of education. And our audiology department at Ocala West provides that walk-in clinic Wednesday afternoon.
Wow.
It's just terrific service. And they're nice to you, too.
That's good to know.
Okay, well, let me introduce our panel today. We have Cece, our nurse manager, who's been on the radio every other month for the last 4 years. Linda, our terrific assistant administrator. I've known Linda for 11 years. And Valerie, who runs Telehealth. And Valerie's been on the radio repeatedly because of the terrific program she has set up at the VA. So let's go ahead, and we have a lot of issues to talk about today. Linda, tell us how a veteran enrolls in the clinic and whether they need to bring in a DD-214 or how they get that.
Good morning. In order to enroll in the clinic, you can come down to the clinic, sit with one of our staff. They will be happy to review the application process with you. The only thing you need to bring with you is a copy of your DD-214, which is a must to have. We need that to verify your military time. And also bring a copy of your driver's license and your Social Security card to verify who you are.
And if I don't have, like me, I didn't have my DD-214, how do I get one?
You can always contact the Veteran Service Office and they can help you get a replacement, or you can go online and do it yourself.
Right. So if you don't have one, just show up and we'll go show you how to get it. And presently, we have a terrific staff. We're looking for patients. So if you're a veteran listening to this and you're not enrolled in the VA and you even think about getting enrolled, drive down to the clinic. We want to enroll you and take care of you.
We are just about up to the first break, so if you want to take a little breath, we'll start the break right now, and then we'll come back and still have a whole 45 minutes. I want the listeners to know that this is a great opportunity for you to call in if you have questions based on what you hear, which we really didn't get into it yet, but we will after the break. The number is, as always, 352-622-9622. We'll be right back with Veterans News. Dr. Mark Knapp is going to be asking and answering questions. We'll be right back.
Weather is brought to you by myfwc.com. Safe boating, there's no accidents. Partly sunny this Thursday with a thunderstorm around this afternoon and evening. The high today 88 to 92, then partly cloudy later Thursday night with a low of 73 to 77. On Friday, times of clouds and sun with a shower and thunderstorm or two in the area, becoming breezy, high 88 to 92. For Saturday, mostly cloudy and not as warm with a couple of showers and thunderstorms around, high 84 to 88. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
This week, it's time to salute Dad, and a wonderful green gift from Bob Wine's Camellia Gardens is the perfect way to do just that. Bob has a buy one, get one on crepe myrtles, and selections include your favorite colors like pink, hot pink, dark red, many more, starting at just $9.99, and it's a BOGO. Dwarf, ever-blooming red ruffle azaleas, still just $2.99. Hummingbird and butterfly plants, many to choose from, $5.99 to $9.99. Better yet, a gift certificate for Dad's Day just can't be beat, cause it's from Bob Wines. See the Bob Wines ad, including all the Dad's Day specials, at bobwinescamelliagardens.net. Come see us this week. Bob Wines Camellia Gardens, 2610 Southeast 38th Street, Ocala, just a mile east of 441. Daily till 4, Saturday till 3, same place since 1952.
Hey Ocala, this is Kelly Hart, Executive Editor of Ocala Magazine. Did you know last year Ocala Magazine won more awards in excellence than any other publication in Florida? And this year, Ocala Magazine was named Best Consumer Magazine in the state. Now you can join me every Friday at 10 a.m. on Ocala Magazine Radio, where we bring the pages of Ocala Magazine to life, right here on The Source. Ocala Magazine thanks you for making us number one. And remember, there is only one Ocala Magazine.
All right, 16 minutes after 9 o'clock. Let's return to Veterans News and Dr. Mark Knapp. Doctor?
Well, thank you very much. We have an administrative show today, and we're going to discuss a variety of topics. Let me move on to CC, our nurse manager. The word PACT, P-A-C-T, is a new term in the VA system, and the VA now has been set up as teams. CC, can tell us how our primary care clinic is organized, and what is a PACT team?
Okay, yeah. Our primary care clinic is run by PACT teams, as Dr. Knapp has mentioned, and the PACT, P-A-C-T, stands for Patient Aligned Care Team, in which each team is composed of a primary care provider, a registered nurse, a licensed nurse, a licensed practical nurse, or a health technician, and a clerk. All these four teams work for the veterans, and we have the veteran as the center of this team. We try our best to empower the patient, so the team will do their best to give you knowledge about your disease processes, do health preventions and disease preventions for you with all these teams. And not just these four people, but they also have interdisciplinary teams that work with them, which is the social worker and the nutritionist, and then mental health comes into place. And in our clinic, we do have 9 PACT teams.
So we have, not only do you have a doctor if you come to the clinic, you get the name of a nurse, and that's your nurse, as well as your social worker, pharmacist, our telehealth nurse, our nutritionist. So we really try to get the veteran involved in a multitude of programs which we're going to discuss here.
Very good, very good.
Wonderful. Well, one of the neatest things we do at the clinic is telehealth, and the VA leads the world in telehealth. And this program is evolving and expanding, and Valerie has set up this wonderful program at our clinic. So Valerie, I'm going to ask you, can you describe on the radio what telehealth is and what are some of the programs we offer?
All right, good morning. Telehealth is something the VA implemented 4 years ago. It is our newest method of technology for enhancing health care, getting patients seen faster in specialty care, and patient education delivery using virtual technology. It's sort of like your FaceTime, your Tango, your Uvu type deal. So the patients don't have to travel. It saves drive time. They'll come to the local VA outpatient clinic, and their provider may be in Miami, or they may be in Pittsburgh, and they may be in Gainesville. So that decrease the drive time for them, and also decrease the time for the VA writing out the travel vouchers.
Oh, yeah. That's an important part of that. Yeah.
Yeah, and we have clinics like cardiology, oncology, we do DME, we have psychiatry, PTSD, the wound clinic, and genomics. That's just to name a few of the clinics that we have.
Really? Wow. What is genomics? What is that?
Genomics, they deal with the testings of a lot of patients that have like different types of autoimmune diseases and stuff like that, and cancers and stuff like that. Do testings and to see what like their family history is about for these different types of diagnoses that they have.
Wow. We do have a phone call. If you'll put your headsets on, you'll be able to hear the caller. And before I put the caller through, let me make sure everybody can hear me through your headset.
No.
No? There should be a knob. Just follow the line on your headset to the knob.
Yeah, turn up your sound. There
Yeah,
you go.
if you can okay.
Now I
Now you
can.
can hear me? Okay.
Yep, got it.
Can you
Can
hear?
you all hear me?
I don't hear nothing.
No, just turn up hers.
Nah, I
If you
do.
would- There you go. Okay. Let me put the phone call through. By the way, everybody's invited to call. The number is 622-9622. Good morning. You're on the air. Thank you for waiting.
Good morning.
I have a question for the vet that had, it's a military disability, but as time has gone on, he's basically unable to take care of it for himself. Can a veteran like that come in and eventually get his, what he was able to do himself, get it done by the clinic?
As far as enrolling in the clinic?
I don't know. I'm guessing they're enrolled, but I'm finding out that, due to age and eyesight, you can't take care of himself anymore. So, could that be seen at the clinic?
Well, I think there's many. The answer is definitely yes, and I think there's many issues, and I'm going to ask our administrator, Linda Morris, to handle that.
In situations such as this, when the patient is unable to make it into the clinic for their visit for health reasons, we have them evaluated by a home-based primary care provider, where that individual will go into the home and continue his health care.
Excuse me, but it's not a matter of being able to get around. It's just that to take care of his condition, you keep it clean, etc., or whatever. He can't do it because, number one.
Okay, so you're talking something like home health aid, someone to.
No, he doesn't need any of that. He just needs some further care other than what he can provide for himself.
Like what?
So he could get there. He could travel to any one of the clinics.
Well, let me try here as well. What I would do, because as I mentioned yesterday at our big event, the VA has a multitude of programs that you're just not going to find any other place. And so in that situation, coming to see your primary care doctor, and the primary care doctor, as Linda said, will decide whether you need home health aid, home-based primary care, or just referrals to specialists to help keep you active at home. If there's a question about disability and compensation, we work with Jeffrey Askew about a mile down the road at the Veterans Service Office, and they do a wonderful job in helping you with the comp and pen. So I think...
the person I'm talking about is a member of the DAV, has his disability, has everything there. He's mobile, capable of getting around, just due to age and the eyesight not being what it used to be, that he needs to possibly have help there, and since it's service connected, it comes down to the DAVs, or he registered at the clinic.
Well, I think that what type of further care and what we can do to help that veteran either at home or with his medical problems, we deal with every hour of every day, and what I would recommend is that veteran come into his provider, his PAC team, and every hour of every day we're evaluating those veterans. The mean age of the patients that we see is 70, and about a third of the patients in the community, I was in private practice for 20 years, a third of the patients I saw were over the age of 80. So you can imagine we're dealing with this constantly, and we're trying to provide not only as much help in the clinic, but also help at home. So I'd recommend that veteran get in and see his doctor.
All right. Thank you.
All right.
Thank
you very much.
Thank you for the call.
Basically, I was just interested.
Fortunately, the VA has programs available that just are fantastic for our veterans.
Okay, do you want to take another call?
Oh, yeah,
We do have another call coming in.
For sure.
Thank you for calling. Good morning. You're on the air.
Yes, good morning. I have a question.
Go ahead.
I lost my DD-214. What should I do?
Well, I feel your pain because I did mine too, so let me have Linda go over that again.
You can contact your local Veterans Service office, and they will be happy to do the paperwork for you to get another copy of your DD-214. Or you can go online and you can apply for one that way.
And actually, again, the Veterans Service Office, Jeffrey Askew, is just a mile down the road, and we send a lot of individuals over there. They provide wonderful service, and they'll help you in a minute.
Very good. The phone line is open if you want to call 622-9622. We do have another call, and I keep asking you to put your headsets back on, but here we go. Good morning. Thank you for calling.
Good morning. Yes, I would remind our audience that Marion County Senior Services provides pickup and drop-off to wherever a senior citizen needs to go, those that can no longer drive, and they have wheelchair-equipped vans.
Yes, thank you for mentioning that. We have what's called the Marion County Veterans Coalition, and the Marion County Senior Services is part of that. And by coordinating all our veterans activities, we at the clinic have just found this out in the last several months. So by getting all the veterans and non-veterans organizations pulling in the right direction, we can all work together and really provide better services for our veterans. But we are starting to use your services, and I think it's a wonderful service for our seniors in the community.
Very good. No calls right now.
It amazes me that once you get organizations in a room and find out what everybody's doing, and we're not recreating the wheel all the time, everybody can be working together for the good of the veterans. For example, if you're a veteran and you need care up in Gainesville, x-rays and CAT scans, we provide transportation. If you just need to go locally and you're disabled and don't drive, and you have a disabled family member, Marion County Senior Services can actually assist you with that, and our social worker now works with them. So it works out very well.
That's my fault. I'm sorry. I'm trying to get it to stop doing that.
Marion Transit, Dr. Knapp, also you have to make appointments in advance, but they will take people
That's
I think
true.
for a very minimal fee, $2 or something like that, to medical appointments.
That's great. Yeah, it's even though we have limited transportation in the county, by using all the services, we really can get everyone some help. Okay, I wanted to ask, one of the neatest programs that I've heard of, Valerie, in the VA, and I don't even know whether it exists yet, is weren't they going to do telehealth for veterans who could not leave the home, and they were going to put computers in the homes so that they could interact with telehealth and the specialist?
Yes, I've been hearing about that for some of the home care nurses that we have down in the clinic. So they're starting. I think they have a couple already. So I think they're going to start implementing that a little bit more. So they'll be able to provide that care for them, because of the patients that are having a hard time getting to the clinics and stuff like that.
I didn't catch genomics. Where is the doctor on the end of the computer that the patient in our clinic is talking to? What state is that?
They're in Utah.
In Utah. So you can see a specialist, super specialist in Utah, and sit in the clinic in Ocala. It's really amazing.
We have about a minute and a half before the break, and we do have a phone call coming in, so we'll try to get the question, and the answer might not happen until after the break. But good morning, you're on the air.
Good morning. I was just calling to find out about how long does it take to get a new patient appointment for primary care?
Very good question. We're very proud of our access. Linda, where are we at these days?
For primary care, it's running about 2 weeks to get into the clinic. We have great access for primary care.
It's terrific. A new patient, never been in the clinic before, 2 weeks.
Wow, that seems to be
really
contrary to what the rest of the country is saying about their care. Yeah.
And I will tell you that also we have a lot of homeless veterans and a lot of veterans in need. And as I was telling the director last week, that if you're a homeless veteran, you walk 2 miles in the rain from the Salvation Army, we don't schedule you in 2 weeks. You're seen immediately.
Oh, wow.
Because you can't be scheduled.
That's a really good policy. we are up against the break, so let's take that break. Remember, today is a special 1-hour Veterans News, and everybody's invited to call if you have questions. This is a great time to call in. Dr. Mark Knapp is answering and asking questions. We'll be right back with more Veterans News. Got a full half hour up ahead. If you want to call in, the number is 352-622-9622. We'll be right back.
Fox News Radio, I'm Pat O'Neill. President Obama and Vice President Biden fly to Orlando today to meet with survivors of Sunday's nightclub massacre and families of the 49 victims.
They're also expected to meet with first responders who were called into action that night. The president is to be greeted at the airport by Florida Governor Rick Scott, who has been asking the White House to declare a federal emergency.
Fox Radio's Evan Brown. Senate Democrats led a 15-hour filibuster on inaction over gun control. New Jersey Democrat Cory Booker.
What we are seeking is not radical. What we're seeking is not something that is partisan. What we're seeking is common sense.
GOP leaders did agree to discuss whether to expand background checks and ban those on the terror watch list from getting gun licenses. First-time jobless claims rose by 13,000 to 277,000 in the latest week. Fox News. We report, you decide.
Ace is the place with the helpful hardware, folks.
I wanted to get my dad a Father's Day gift that he would use.
Kimberly was looking for gift ideas, so I took her through all of our Craftsman and DeWalt tools and our Toro mowers.
Ace is the place to thank Dad for all he's done, with a gift that lets him get more stuff done.
Head to Ace now to get Dad the best gifts from our best brands and receive a free gift card for up to $50 each with select Craftsman, Toro, and DeWalt purchases. Offer valid through June 20th at participating stores. Gift cards must be used on a future purchase and are subject to terms and conditions. See store for details.
Hey everyone!
This is Life Tips with Geico.
Life Tip 1. Use a shower squeegee to remove pet fur from carpet.
Squeegee is also very fun to say. Consider it when naming a pet or child.
Life Tip 2. Switch to Geico and you could save hundreds on your car insurance.
With over 75 years of experience and a 97% customer satisfaction rating, they know what they're doing.
Geico. Get savings into your life. Visit geico.com today.
People say stop and smell the roses, but that's not easy when your nose always closes. When life gets busy and your nose flares into a tizzy, acupuncture can clear up your nose so that you don't sound like Miss Piggy. Come see me, Dr. Erica Olstein, at A Better You Healthcare just off of 27th Avenue behind the Paddock Mall. Call today to set your acupuncture appointment, 352-615-5566, and visit abetteryouhealthcare.com.
You've got a garden and we've got a show for you called You've Got a Garden with your host, Master Gardener Carol Ann Baldwin. Carol Ann answers your questions about your flowers, your veggies, your grass, your trees, even questions about your bugs. And she's only on WOCA, so don't miss Carol Ann Baldwin and You've Got a Garden each Tuesday from 9 a.m. to 10 a.m. right here on WOCA The Source.
Good credits, bad credits, it's none of our business. Because we're not an auto dealer. We're not a bank. We're not your mother. We're OcalaForSale.com. Marion County's marketplace for cars, trucks, and SUVs. We've got thousands of sellers standing by to take your call. No middleman. But hurry, don't walk, don't run. Just sit down and log on to OcalaForSale.com. Prices and inventory change daily. Offer does not include dealer upcharge. Undercutting, rust-proofing, factory surcharge, or delivery fee. See website for details.
Hi, I'm Leah Caruso with Strive Rehabilitation, inviting you to join me Thursday at 11 a.m. for Health Matters. Ocala Health and Strive have teamed up to bring you the latest information on good health services available to you right here at home. This vital information will help you make informed decisions about your health. So don't forget to join me here at 11 a.m. Thursday. It's news you can use from Ocala Health, Strive, and your friends here at WOCA.
Hi, I'm Seth with AA Lock, Dock, and Security. Have you ever thought about the locks or security on your house or business? Have you ever wondered why the keys to your new car cost so much? Well, at AA Lock, Dock, and Security, we can help with securing your valuables. We can even replace those expensive transponder keys. we can give you the knowledge that no one else will. Call AA Lockdock and Security at 867-1965. That's 867-1965.
All right, 25 minutes before 10 o'clock. Looks like another beautiful Thursday. And let's continue now with Veterans News. Dr. Mark Knapp. Good morning again, Doctor.
Hey, good morning. We want to mention our sponsor, Bob Wine's Camellia Garden and Nursery. When it comes to landscaping, Bob Wines has what you need. And everything from small plants to large trees, mulch, fertilizer, and so much more. Bob Wines will even deliver. They'll guarantee their plants and trees. Bob Wine's Camellia Gardens has been keeping you blooming since 1952. Okay, and then we'll move on with our program.
Move on, okay.
Okay, Linda, let's go back. We've made a lot of changes in the clinic in the last 6 to 12 months, and we've changed now how veterans make appointments. In the old days, we just mail people a letter, and if you didn't get your letter, you wouldn't get your appointment. We've really changed that. Can you describe that for us?
Well, now we have gone to a process of direct scheduling. For Ocala West, with our audiology and optometry, they no longer have to call the primary care provider to get a consult to get an appointment. They just call direct to the clinic and they are scheduled. With our primary care, we are doing face-to-face scheduling. No one gets an appointment without talking with that veteran. When they come in for a primary care appointment, when they're on the way out, they stop with a clerk to check out. They receive their appointment at that time. If something come up that appointment need to be changed, the veteran can always call in and make that change with that appointment. But nothing is never done without talking with the veteran direct.
So a big change, that was directed by Washington. So you make your appointment at the clinic. I do want to mention one thing to our veterans, which I mention every time they come in. And if you have a test up in Gainesville, they call you. And the reason they call you is to get better access. So in other words, if they have an opening next week, you'll get your test next week. The problem is you have to have a working phone, and we have to have the accurate phone number on your chart. So we're checking all the phone numbers, addresses, and we're encouraging everyone to please answer your phone during the week. And that way we can really get you in faster and get your testing done. Okay. And CC, one of the things that when I go out in the community, our veterans always ask me this, especially when we go to the Ritz Hotel. How does a veteran get to, they don't need to talk to their doctor, but they want to talk to their nurse, and they need questions about medications or about something that's going on. How do they get to talk to their nurse or PAC team?
Okay. They can use the phone to talk to their nurses, and our phone number is 352-369-3320, and the nurse will answer them. Or if the nurse is not available at that time that they call, the clerks will get their phone number and relay that message to the nurse, and the nurse will call them back. But there's another way for them to contact their team, and this is through the secure messaging, which you use your computer, and it's just like emailing your provider, and it's not just your provider. The whole team can access your email. So you can get a response either from your nurse, your doctor, or your clerk. But for you, if you're going to use the secure message, it doesn't have to be any emergency. It's non-emergent situation or concerns that you may have.
So how do you get signed up to email your doctor?
You have to sign up first on www.myhealth.va.gov. You sign up, there's a little clip that you're going to watch, and then after you watch that video, you print out their certificate that you did watch the video and it was you that registered. But next time you come to the clinic, you let the clerk know that you did watch the video and that you would like to get access to that secure messages. So they will identify you and verify that it's really you. When you go back to your computer, you just check that little orange button to say that you will be doing the secure message, and at that point, you can have the access to communicate with your providers and your team. And that's also a nice site for you to access your own personal medical record.
Very good.
Very good. No calls.
Okay. So, and actually, as Cece said, you can actually get your records. You can get your blood work. You can look at your notes. You can see what your CAT scans show. So, it sounds a little bit confusing, but if you come to the clinic, we'll get you started. And I think there are 12,000 unique patients. What do we have? A couple thousand veterans that do that. So, when you call the clinic, there's sometimes you have to wait on the end of the phone, and if you're sign up for secure messaging, you can do a lot of that right on the computer. It's wonderful.
And there's no phone tag.
No phone tag. Speaking of phone tag, we do have a phone call coming in right now. If you can just put your headsets back on. And
Thank you very much.
Say good morning. You're on the air. Thank you for calling.
Good morning. If I was to get out of the hospital, how do I get an appointment for a follow-up if my regular appointment is not for months?
Good question. That's really important because we want to see you when you get out of the hospital. Cece, how do we do that?
Okay, if you're coming out of the hospital, all you have to do is call the clinic again and let them know that you're being discharged. The important thing is our doctors or your provider will need a copy of your discharge summary. And that will entail what had happened while you were in the hospital, and if there are any continuation or plan of care, that is important for our providers to know. So give us a call, and your team will call you and reschedule you an appointment to see your doctor.
Great.
Okay, thank you.
So you just let us know, and then we'll get back to you and get you into the clinic.
Very good.
There are some high-risk diagnosis that individuals have when they go in the hospital, such as stroke, heart attack, heart failure, or pneumonia. And if you're in that one group, we want to actually get you in and see you within about 7 to 10 days to make sure you don't end up back in the hospital.
And in the case of somebody going in the hospital in Gainesville, does the primary care doctor here in Ocala automatically get notified?
Yes.
We look at your notes every single day, and when you're discharged, a note sent both to your nurse and the doctor, and so we know what's going on. It's probably best if you have something complicated. If you can go to Gainesville, obviously with emergencies, a lot of our veterans will go locally here. Okay, well, very good. One of the, I think telehealth was set up because of our lack of access for mental health. It's very hard to hire mental health professionals in the entire country. So we really specialize in our mental health program. Valerie, can you tell us what that consists of and where we're going with that?
Well, with our mental health right now, even though we've lost one of our remote providers temporarily to probably about the end of August, we're still able to utilize our Gainesville mental health provider as well as our Miami. So our access to mental health is really good. You know, we don't have anybody waiting to be scheduled right now. I'm able to get patients in within 2 weeks to be seen. So it's
2
really
weeks
good.
access. Wow. That's incredible.
How
How do the veterans do with mental health, telehealth?
They love it. They love it. They have no complaints. I thought it was going to be a clinic that was going to be, patients going to give a little pushback on it, being that they're not actually in the room with the provider, but the patients love the idea that they don't have to travel anywhere. They didn't have to wait 3 months to get in because it's such a big wait list. Not only, was within the VA, but on the outside, trying to get in on the outside, it takes about 6 or 7 months just to get into, if you could find a mental health provider.
You can find a mental health provider,
Yeah.
that's right. And it is a big television screen, so it's like having somebody interacting with you just as you're talking back and forth. It really is a terrific program.
Wow, that's amazing.
Okay, well, very good. Linda, one of the issues on the radio we've been talking with our veterans about, and we're trying to actually improve this. We have a large no-show rate for some of our specialties. And, it really affects trying to get access for the veterans that need care. What can we do about a no-show rate?
Well, part of the process of having direct scheduling and negotiating the appointments, not making appointment without talking to the veteran, that process was put in place in order to help with the no-show rate. If a patient is telling you and looking at their schedule and you are scheduling an appointment when they have availability, then it helped cut down on no-show. And so far, it have proven to be something good because our no-show rate has dropped.
Oh, good. Perfect. And some of our really premium appointments like mental health, actually we do have a 20 to 25% no-show rate, which means that we actually are hiring one person to do nothing because the veterans aren't coming in. So this is your VA, and if you're coming to the VA, please keep your appointments. And if you can't keep your appointment, come on over or call us and let us know, and we can actually put another veteran right in that spot.
We're up against the next break, so let's take that break right now, and then we'll be right back. If you would like to call in, you are invited to do that. The number is 352-622-9622. We'll take that break and be right back with more Veterans News. Dr. Mark Knapp and his staff answering and asking questions. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating, there's no accidents. Partly sunny this Thursday with a thunderstorm around this afternoon and evening. The high today 88 to 92, then partly cloudy later Thursday night with a low of 73 to 77. On Friday, times of clouds and sun with a shower and thunderstorm or two in the area, becoming breezy, high 88 to 92. For Saturday, mostly cloudy and not as warm with a couple of showers and thunderstorms around, high 84 to 88. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Are you in need of custom screen printing, embroidery, or promotional items? Then look no further and come visit the brand new Legacy Team Sales. LTS is conveniently located off 17th Street next to Armstrong Homes in beautiful Ocala. We offer the best prices and highest quality products for your company, team, school, or nonprofit. Whether looking for screen printed shirts, embroidered polos, or travel team uniforms, you'll be sure to find it at Legacy Team Sales. Come visit our new 27,000 square foot facility. Our friendly and knowledgeable sales staff will assist you in every part of your custom purchase. LTS carries the hottest brands in the industry like Under Armour, Russell, Mizuno, Asics, Badger Sports, Gildan, Pacific, Ogio, and many more. At LTS, screen printing embroidery is done in-house and we guarantee customer satisfaction. Stop by, give us a call, or check us out on the web at shoplts.com. Remember the name, LTS.
What do you love most about July 4th weekend? Is it the food? The family? The fireworks? Well, this July 4th weekend, add one more word to the list. First, as in the first Coke Zero 400 at the world's first motorsports stadium. Everything you love about the holiday gets a huge upgrade at the all-new Daytona. The NASCAR Sprint Cup Series Coke Zero 400, powered by Coca-Cola. Saturday night, July 2nd. Guarantee your seats at 1-800-PIT-SHOP or DaytonaInternationalSpeedway.com.
Think you know NASCAR? Prove it. And you'll be entered for a chance to win tickets to the Firecracker 250 and the Coke Zero 400. Every day between now and June 24th, we'll be giving you the opportunity to call in during the morning show and the afternoon show to answer trivia questions about NASCAR and Daytona International Speedway. All callers will be registered to win, and on Friday, June 24th, we'll pick the winners for one of the most exciting nighttime events of the season. So tune in to win right here on The Source.
Here's what you may have missed on the John Tesh Radio Show.
And they found that having regular, positive contact with neighbors was linked to a greater sense of personal growth, self-worth, and purpose. Turns out some foods help us release more pheromones, which are chemicals in our sweat that send the message, hey ladies, I'm healthy and I'm worth getting to know. The problem with thinking your glory days are behind you is that it prevents you from enjoying the present.
Intelligence for your life on the John Tesh Radio Show. Don't miss this stuff.
All right, 12 minutes before 10 o'clock. Let's return to Veterans News. Doctor?
Thank you very much. Let's move on to some other topics since we have just a few minutes. We do offer same-day appointments. So if you're sick, what should a veteran do to get a same-day appointment to see the provider, CC?
What we do recommend is for you to give our clinic a call and tell them what's going on, and your team will assess if you need to be seen that day. And if you do need to be seen that day, we have availability for you to be seen. But we would prefer that you call instead of just walking in, because if you walk in, you might end up waiting longer, and we don't have a exact answer of how exactly when you will be seen. But at least if you call, we can give you a time, and you don't have to wait forever.
That's exactly
but we
right.
do have access.
Yeah. So we'll get you in. It's just that we have times throughout the day. And so if you give us the opportunity, then we could get you in at maybe 11 o'clock or 1 o'clock as opposed to you sitting for a couple of hours. So give us the opportunity and we'll get you in and take care of you. Let me move on. Linda, there's a lot of sticky issues here that we get asked questions about all the time. And this changes a lot. And so can you explain exactly what a means test is? How is that relevant? And how do I go about filling out a means test? Where do I get a means test?
Thank you for asking that question because it is a big concern with our veterans, especially since it ties into co-pays for the veterans. In an effort to make things easier for our veterans, our Health Eligibility Center has taken on the process of doing the means test, their financial statement annually. But yet still in the process of this getting started, some fall through the crack or they are not quite up to where they should be. And if that veteran walk into the clinic and it pops up when they come in that they need a financial statement, we handle that right there in the clinic at that time. Sometimes veterans come in, don't have their financial information, don't know it, need to bring it back. We give them the form. We highlight what they need to do, what information is needed so that they can provide it to us. And when that form come in, it's processed in the same day. And a lot of veterans, especially with the economy the way it is and healthcare being costly, they are concerned because a lot of them are on pensions. With the pension level, once that financial statement is in place, their co-pays go away. Pension level for a single individual is $12,868. If their income fall in that range or below, they don't have to make a copay for medications or for their doctor's visits. If you have a dependent, it's $16,851. So it's very beneficial to keep those financial statements up to date yearly. A lot of times we have veterans that'll call and they'll say, I never made a copay before. Now they're sending me a copay that I need to make one. So when we check the record, we see that they're beyond that copay statement, then we take care of it.
Very good. So we'll help you with that. So you come to the clinic, we'll get you to fill out a means test. And as Linda had mentioned, as we all get older, we seem to make less money, from Social Security or whatever and have more bills. So if you didn't qualify to come to the VA because you're making too much money 5 years ago and your situation has changed, then you may qualify. Mm-hmm. So you can come over to the clinic and fill out another means test. And you may qualify. And when it comes to hearing aids, glasses, and everything else, it's certainly worthwhile.
Absolutely, yeah.
Is the income level higher? I know you mentioned the copay for medicine, but how about the copay for actually medical treatment? Is the income level higher or is it the same?
It's about the same. For your income can't go over $38,000. This is for one dependent, but if you're a single individual, it's $28,000 in order to qualify for VA health care.
And keep in mind that now, for example, a lot of medicines cost $10,000 a month. There's one course for the hepatitis C that's $85,000 for one treatment. Wow. And our copay, say you qualified to come to the VA and you still have a copay, our copay is $9 per prescription per month. Wow. So if you come over with a prescription that costs $3,000, for a couple months, the copay is $9 per month, or for 90 days, it's $27.
Can't beat that.
So it's really worth your while.
Yeah.
And a lot of our veterans will come over only for the hearing aids because Medicare insurances Blue Cross will not pay for hearing aids, and they're up to $6,000 for hearing aids. And if you qualify, I think it's $50 for hearing aids.
Specialty.
Yeah. Mm-hmm. It's really worth your while to investigate that.
Wow, and what you said earlier in the show, that a lot of the hearing aid people are not using them.
Yes, for sure.
This is kind of troubling. They're expensive. They can help them out. Their life can be so much more improved. And
So, and that's one of the services that the VA provides is that Wednesday afternoon, if you get your hearing aids and you can't use them and your wife is on your case and you come over and they'll show you how to use your hearing aids.
Well, maybe that's why they're not using them. Now I understand.
That Wednesday walk-in was set up to help the veterans to be able to fit their hearing aids, and if they needed adjustments, to make the adjustments.
Is there anything you can say about the batteries? I don't know anything about hearing aids. Are they expensive?
No, the batteries are provided.
Provided now. We provide them.
Oh, really?
Yep.
They receive a year's supply at a time.
Oh, wow.
And that's different.
That's pretty
10
good.
years ago, we didn't provide the hearing aid batteries. Now we provide them.
Okay.
I was out at one of the VA events, and I took my wife, and we walked up to our audiologist, and I introduced her, and the first thing she said is, he can't hear. He turns the TV up loud. He needs hearing aids. And like all veterans whose wives say that, I said, I don't need hearing aids. I hear fine.
That's funny.
Well, we have just a couple minutes. I want to hit a couple more topics here. We have an outstanding dermatology program, Valerie. Can you tell us about Telehealth Dermatology?
Well, first of all, a lot of people don't know that when we started Telehealth, it was the latter part of 2012. And from the national level, I'm only required to do 10 per year. I average about 325 photos a year. So I'm way over. So I'm doing them probably about one a day at least that I'm covering. I've done over 1,300 telederm photos since we started. So it's definitely a program that is needed because I use it on a daily basis.
Is it a moving picture that you?
No, we have a Canon camera that we use.
Still picture?
And we take the photos and those get uploaded in the patient's chart. Dermatology, they read those photos and they determine from those photos if they need to see that patient to come up for a chirotherapy or a biopsy or anything like that. So it saves them time at the same time, because if they don't need to be seen, they didn't drive all the way to Gainesville. Sometimes they may just need a topical ointment and they'll just send it out in the mail to them.
Oh, wow. That's amazing.
It really is, and I tried to see a dermatologist. Dermatologists are hard to find, and the VA provides that service. And every day we're referring veterans up to Gainesville for dermatology.
And I want to add to that, Dr. Knapp. I track these patients to make sure that they're being seen. And if the dermatologist say I need to see this patient face to face within 2 weeks, and I go back and check my spreadsheet, they have an appointment.
That's good.
They're in there.
That's really good.
I was kind of curious, and obviously I'm embarrassed that I don't know everything that Valerie does. She does so much, and she has 2 rooms. Has veterans in, moving from room to room. Is any of the services they use other equipment like stethoscopes?
Cardiology. It's not your typical stethoscope. This stethoscope is connected to our video computer screen, and you can hear the heart and lung sounds in New Mexico if you had to, and it's clear as a bell. The doctor can auscultate the sounds of the lungs and the heart for our congestive heart failure patients. So they follow right there in Ocala. They don't have to go to Ocala just for the provider to listen to the lungs. They sit right here at the clinic, and the doctor can hear everything.
Wow. And the other vitals, the blood pressure and all that, you just do that in the clinic, or is that also by tele?
We do that in the clinic. We do that manually, but the stethoscope is connected to the video so the doctor can hear the heart sounds in Gainesville or wherever they're located at.
Wow.
Can they do the pace checks like that now, too?
Yes, because some of the patients do have pacemakers, so they can hear that as well.
That's good news.
If you have a question, we've got about 2.5 minutes left. We can probably squeeze at least one more call in. The number is 622-9622. We do not have a call right now. No.
Very good. Linda, recently they had an article in the newspaper about the new Ocala Clinic. When are we getting a new clinic in Ocala?
With the lottery.
It's growing concerns for a new clinic in Ocala, and we would love to have everyone under one roof, everything in one location. But again, with our economy, with the cost, it's tabled right now. So we're waiting to see when that will be.
So it really is up to Congress, not us. And I think that I had read in the front page of the Star Banner that we are, when we finally get a clinic, it's going to be 45,000 square feet, if I'm not mistaken. Wow. So right now, amongst our 4 clinics in Ocala, we have 15,000. So the new clinic will be under a roof, 45,000 square feet. So hopefully that'll work out pretty good for us.
What do we have there that we don't have now in the new one?
Well, good question. Now, Congress decides, according to the size and needs, size of the clinic and needs of the community, whether you can have, for example, radiology or specialty. And for example, in the last 6 months, Congress decided that we're entitled to podiatrist. So in January, we have a podiatrist on site who's fantastic, and our veterans do not have to go to Gainesville to see podiatry. You'd think, well, is she being utilized? 100 veterans per month she's seeing.
Wow.
Over 1,000 per year.
Got 50 seconds.
Okay, well, let me go ahead and finish. And what I wanted to, again, say at the end of this program, we want to thank you for all your questions. Our goal is to empower our veterans to really take good care of your health. And we've talked today about access. Access is extremely good, but we need everyone to have phone access. Call if you have any problems. If you need to be seen, please get used to identifying your PAC team and calling your PAC team. We have issues with no-shows. So if you have an appointment, please keep that appointment. And if you can't make the appointment, please call and we'll get another veteran and reschedule you. Thank you very much.
On behalf of Hank Whittier, God bless America.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala.
Fox News Radio, I'm Pat O'Neill. Search teams in the Mediterranean say they found the cockpit voice recorder from the Egypt airplane that crashed last month.
The U.S.-operated John Lethbridge spotted wreckage of Egypt Air